Economic Forum released a stat that over the next 20 years, the cost of lifestyle and non-communicable diseases would be about $47 trillion to the system. And a lot of these non-communicable diseases are inherently preventable as lifestyle diseases. They're how we're moving around, how we're sleeping at night, what we're consuming.
Our life is a continuous function. We are not now consumer and then patient, going in and out of a system and thereby creating costs. We should be in that system and out of that system all our lives. And we should monitor it ourselves, and we should try to, see the symptoms before they arrive.
I think the system has to learn how to be more flexible, more fluid, respond better to how conditions change. Quite simply, there's not enough money in the system to carry on doing things as we're doing them right now. And we have to evolve. Part of this will put more onus on the patient to be more proactive in the way that they deal with the diseases and the conditions that they have.
I think right now we're in the stage where there are a lot of early adopters for technologies. So doing the 23andMe test, wearing your fitness gadgets, we're in the early adopter stage. And those folks are certainly going to their doctors who are probably at One Medical or some of these other concierge places and demanding that the doctors understand and can talk to them about these tools that they're using in their own personal lives.
The trends that we're gonna see happen is really the ability now to go from a gadget or a widget to an actual ecosystem where that data is given meaning, and then it allows people to be coached towards better health using that data.
When you start transitioning across to the more clinically relevant information that these things are tracking, then that's the point it becomes really, really interesting, because then you can start affecting real change.
We see this huge gap that exists between intention and action, what people think they're doing and what they're actually doing. And I think that transparency of seeing that starts to help people understand what are the patterns that they thought they were doing, and then where can they make adjustments to live the life that they really want to.
The transparency of this information to the patient is of greatest importance. With mobile health and digital health technology, I think that patients are becoming extremely empowered to learn about their disease states and what's available to them, and it's an opportunity for this new healthcare environment to leverage.
We haven't really evolved in healthcare from a technology standpoint outside of the electronic medical record. Whoop-de-doo, EMRs are records. They tell you what happened. They don't tell you what's happening. And I'm more interested as a doctor who diagnoses and sends someone out of my office, what's happening? What's that journey like? Because I know most doctors know what that journey could look like and should look like, but we don't know what happens until either the wheels come off and they wind up in the ditch, or they do fine and we never hear from them.
Right now, the traditional model is you see a doctor 3 times a year, and that communication that you have with your doctor has to be confined to those little, exam room visits. It's kind of nonsense. I mean, healthcare is a conversation. It's not just an exam room. So if we can say, all right, if the conversation can happen on your own terms and on your own time throughout the year, not defined by the exam room, it totally fundamentally changes everything.
This trend towards patient empowerment, I think, is really key to that, where patients no longer want to feel like just a number, a cog in a machine. They want individual treatment tailored towards them, and they expect more from the medical system than they did in years past.
At the moment, we're in a really exciting part of the curve when it comes to innovation and healthcare and the convergence of the two. One of the big kind of change that we've experienced recently, we've had the explosion of social, really, and that's had massive implications upon healthcare and how people connect. Not just in the wider context, but as doctors connect with each other, as patients connect to each other, and as they connect, and as patients connect to doctors.
We're listening to our patients. We're also telling them stuff that's relevant and important and interesting along the way. But we want to learn from them, because they're the person with the problem, and they know best what's working and what's not, and what they wish had happened versus what they wish they were informed of.
we have to also guide our doctor in that personalization. So I kept these are my stats, these are my readings, and this is where it went wrong. And this is where I started to take this medicine. What do you think? I think the 21st century is about recommendations. The doctor gives this recommendation, but you also look at what expert patients say who just went through that illness, what they say.
The physician now is more of a partner with the patient, and less of it's less top down than it was in the past. I think in the past, patients would view physicians as authority figures and simply listen to them in a more unquestioning manner, whereas now it's more of a partnership, a mutual consultation of two people trying to collaborate on solving the patient's case.
We had, procedures, we had medications. Now we have tools like apps to help you understand your disease and also give us a little data about, if you can come in and give us information about your headache and what's going on for the past month, I think we can be better doctors. So it is really a new toolkit for us.
We've already seen that doctors are prescribing apps in some countries, and I think that we'll get to the point where that becomes a normal thing to do. You'll get prescribed a diagnostic device. You'll get prescribed the equivalent of a fuel band or something. And this will mean that we have much more data coming back into the system, much more real-life data, which means that the clinical data that we have, which we do through clinical trials, which is basically a proxy for real life, we'll have the real life data, which will mean we're much more informed then about the decisions that we do make.
We're moving along, giving the lines of giving patients more control and having devices developed that do give them that control. And I think eventually we'll move to a system that allows patients to enter data into their electronic medical record, whether it's directly from a device that's attached to them or it's basically them providing their input.
In the future, your doctor is not going to rely only on what you tell him, but you could go to your doctor with actual figures and quantified things of your life, and he will take decisions based on actual facts and not just on how good or bad you remember actually how you were doing. So this is, I think, the actual real change, making sensors that will make all things knowable.
And if we now can look in a systematic way into this data, and not only from one hospital, but from several hospitals in several countries, we can detect special patterns that we would never have seen elsewhere or that we never could see before launch. And that's really interesting.
In the generation of Facebook and Twitter, social media, blogs, patients expect to be able to tap into knowledge from a broader range of sources, whereas in years prior, a patient might just view their doctor as the sole source of information. But now people expect to have lots of sources of information and less reliance on individual experts.
The most searched thing on the internet is health. So people are trying to initiate and participate, but they're participating with a flat, one-dimensional, non-contextual, data set that may have nothing to do with them, that generally makes them more anxious because they find something in there that they weren't intending. Oh my God, now I got cancer.
Our role, ideally going forward, is all about curating the information, like steering patients toward new tools, and doing the traditional thing like prescribing medication and doing procedures and things like that.
So first and foremost, there's going to be a shortage of 90,000 doctors by 2020. So we can't sustain this model. The good news is that what I just told you is that this is not a pill-based approach. It's about behavior and lifestyle. So doctors need to be orchestrating the process. We actually can have health coaches that take the data, algorithms that drive what we're supposed to do, and people just monitoring that. So in other words, physicians actually can play a bigger role in analyzing the data and saying what the data means, but the actual coaching and the process of actually health improvement and health care can actually occur by physician extenders.
I actually believe that the use of technology, although taking away the human touch from a lot of what we do, is actually going to bring more personalized medicine. And these systems are going to change the experience for the patient. And the patient's going to be monitored in a variety of ways, including wearable devices that will track how much they move, what their temperature is, what their heart rate is, including devices that are included within the packaging of their medication, which will indicate if they've taken their medication or not. But the important thing is not the information in itself. The important thing is what we do once we have that information.
So with the emergence of the more of a virtual relationship with the physician, I think it means that we're going to be able to have a relationship with a physician which is more regular, it's more consistent, but it's much more resource friendly. So from the patient's point of view, it's going to be more convenient, it's going to be much more timely, and from the healthcare system, it's going to be cheaper. It's going to be more accurate as we have more decision-making resources behind it. And it should eventually lead to better outcomes, better health.
Care will be delivered based on the preferences of the patient. And I think that's very important, because as people will begin to care about the preferences of the patient, and models will evolve to deliver that preference within a compliant, HIPAA compliant or regulated fashion, it will evolve towards the market need. And those patients that are comfortable with a telemedicine approach will entertain that market. And those patients that continue to want the face-to-face, one-on-one feeling will entertain that.
And there's all these fiefdoms in medicine. We need to go from silos to Legos. Everything should be a Lego. Everybody should build their good outcome, with a Lego kit. And that hospital doesn't talk to that one because they're using different systems. And all this technology, people have walled it off and made it expensive because it's medicine. And those days are numbered.
There's kind of a perfect storm coming right now in healthcare. On one hand, the regulatory environment is becoming really favorable for innovation because insurance companies, which have generally had a ton of power, are now starting to really compete for quality and services. So they're really starting to invest in technologies that can help them provide better care, whereas before they were almost, you just were stuck with your insurance company.
Is the day of buying into a health plan gone, and does it become a personalized health plan? As we start tracking, we do genomic testing and we start understanding, well, actually, there is a percentage chance that this is the journey of my life when it comes to illness and disease. Are you going to have a plan which is specific to you?
So we're going for a complete new and connected experience where patient will be. The patient is now the most underused resource, and the consumer before he becomes a patient. So I think the emancipation of the patient, the emancipation of the consumer in medicine will be very important.